back to the Price of Business. I'm your host, Kevin Price, talking to you about you and your business. We're continuing our series of programming on the price of ADHD business with my partner in this project, Frank Granett, who is with a great organization, CAOOY.org. Frank, let's talk, first of all, talk a little bit about CAOOY.org and then our series, real quickly on both, and then introduce our great guests. I've been looking forward to this conversation today. Go right ahead, Frank.
Yeah, sounds good, Kevin. CAOOY is Coalition Against Over-medicating Our Youth, and we're basically a nonprofit educational charity. We educate not only health professionals, but also business leaders to understand the value and the critical need to give kids a voice before we use premature drug therapy in children especially. And we're talking about stimulant as well as psychiatric medications. And to this point, Kevin, in the past we have fabulous guests, and today is no different. She is the Assistant Dean at the GEC Graduate Institute School of Pharmacy in Claremont, California, and she was a former psychiatric pharmacy specialist, which basically she went into the completion of research into the overuse of psychoactive medications, especially in the young child population. And Dr. Tallian, great to have you on our program today.
Thank you very much. It's a pleasure to be here as well.
Tell us a little bit, first of all, before we get started, I just want to mention the website is pharmacy.kgi, as in Keck Graduate Institute, .edu. Kind of give us the background, the elevator speech of KGI.
Well, KGI is a new school of pharmacy that we just admitted our first class this fall. It's very exciting. We have 72 students, and we're have the vision of really progressing pharmacy beyond what its normal education structure is today.
Very good. Frank?
And, Dr. Tallian, as far as the pharmacy, and I'd like our listeners to understand that, the pharmacist is actually the gatekeeper of administration as far as the dispensing of these types of compounds. What do you feel in the educational part, as far as pharmacy school, do you feel we're turning a corner on educating our new pharmacy students to recognize the need for further assessments in young children, especially before we go to these powerful type compounds?
I do think so. I mean, we do have electives in our curriculum that students will take, but there is a basic need throughout that we'll mention in teaching students about psychotropics in general and making sure patients are adequately treated, but also how to monitor for serious side effects.
I'm just interested about the starting of a new school like this. What motivated that?
Well, I think that there was really the Claremont Colleges and Keck Graduate Institute really saw an opportunity for pharmacists to get involved in the pharmaceutical industry, that there's a lot of positions where pharmacists actually have a lot of training and actually could do a lot of great work, not only just research, but educating other healthcare providers and also the vision of how drugs are developed.
That's interesting. Frank?
And Dr. Tallian, as far as our pharmacy students coming out of college now and graduate school, they are, doctors now, doctor of pharmacology, PharmD, career paths. Do you feel, as far as with your background in psychiatric, as a pharmacy specialist in psychiatric drug therapy, do you feel the teaching of that right now? What are you doing at your school now to, is there an implementation of those types of electives you talked about a minute ago? What exactly are you teaching as far as new assessments that we can, help parents, get their kids back on the right track?
So we'll incorporate this as part of our regular structure of our curriculum. We will teach the students rating scales, which are a way to assess if the patient's appropriate for a certain type of therapy. We'll also be teaching them what the psychiatrist does as far as the criteria for determining whether or not a patient is appropriate for even being treated. And I think that, as our students actually, too, are going to have physical assessment from head to toe, similar to what physicians and nurse practitioners get in their training as well. And so I think these together in combination, as you mentioned, that pharmacists are now doctors of pharmacy. That's pretty much the end degree at this point. And that they are really partners as part of the healthcare team, not just one of the behind-the-scenes folks. Pharmacists are on the floors. Pharmacists see patients. They can work under collaborative practice and care for patients, such as psychiatric patients that I've done in the past.
By the way, I do want to mention again, the website is pharmacy.kgi.edu. Go ahead, Frank.
And Dr. Tallian, as far as the research that you've done, real quick, could you just explain what stands out the most that you've done in the past, as far as this research for the over-prescribing aspect of these types of compounds?
Well, I think really it's an education. My primary research related to over-medication has been education of physicians and, in particular, patients' families, as well as some of the nurses that work with these patients very closely, along with social workers. And this research has been mainly is more of an education that, if there's something going on with your child that doesn't seem right, making sure that they also are an active part of their child's care rather than, relying heavily on the physician as in total the caretaker for the patient.
It seems to me that over-medication still seems to be a pervasive problem out there, but I'm beginning to think that Frank is no longer becoming is just a lone prophet in the wilderness out there. Are you beginning to see, Dr. Tallian, a shift in thinking when it comes to over-medicating?
Well, I think it really depends who's prescribing the medications and how how up-to-date the prescriber is with these medications and familiarity. When I speak to a lot of primary care physicians, which ADHD used to be mainly managed by neurologists and psychiatrists, now it's more for the mass pediatrician, and I think they feel very uncomfortable many times prescribing these drugs. They're sometimes based on the parents' needs and or the school are needing to prescribe these medications. But I do say that there is more training for the physicians in this area. Plus, there is more of a movement from the general pediatric community to understand not to over-prescribe. Especially parents are demanding not to do that, and they will say my child's over-medicated and we need to back down on the medication, or I'm not going to give the medication.
Frank Granett, he can be found at CAOOY.org. Our guest today, Dr. Tim Tallian from the KGI, is the Keck Graduate Institute. That's pharmacy.kgi.edu. Frank, final thoughts?
You know what, Dr. Tallian, I appreciate your perspective, and I'm glad to see somebody at your caliber is making a difference with this, respect to pharmacists and educating our new students becoming PharmD professionals and recognizing the need for more assessments before we go to drugs. And we appreciate, Kevin and I, your perspective today. And thank you.
Thank you very much. When we come back, much more for you. Do want to remind you, best content here shows up over there at usdailyreview.com. And I am Kevin Price. This is The Price of Business.